everybody. I hope you're all having fun. What amazing presentation so far. So, who knew science could be so fun? Anyway, don't worry, I can say that as I'm not a scientist actually, I'm a nurse. So I'm a nurse that studies medicine, but not to become a doctor. Well, it is actually to become a doctor, but not the type with the money or the attitude. I'm becoming a research doctor. So basically, I'm going to be a doctor nurse. So as you can imagine, I have a bit of a hard time explaining my job to people. So let's put it like this. I can't write you a script for your Viagra, but I can check out the manky wart on your big toe. The joys of being a nurse, hey? And I can do some research. So tonight I'm here to talk about sleep. Look, this talk is relevant for all of us as we all sleep. Well, we should all sleep. If there's anybody out there that claims they can't sleep or they don't sleep at all, please come and see me afterwards because you really need some help. Now, who out there thinks I've got perfect sleep habits? Not many? No? None? Did you notice I stayed silent as well? Look, I'm not perfect. Or at least my husband thinks so when he has to wake up again to turn my phone off after I've fallen asleep watching pimple popping videos on TikTok. What's that saying? Do as I say, not as I do? That's a classic nurse line. Used in particular by those nurses that I used to see outside the Royal Adelaide Hospital smoking with their patients. So, for those of you out there, I'm sure there's somebody that's not willing to admit they've got perfect sleep habits. But if there is someone out there, go you, I'm so proud of you. You don't need this talk. You can actually spend the time instead going to perhaps Pete Evans' Instagram and learn about how staring at the sun cures all diseases. Or perhaps check out that Goop handle that you've had your eye on. But for the rest of us, I'm here for you. Look, I know it's hard. We all lead busy lives. TikTok is calling out to us at night, watch me, watch me. But I'm here to help. It's all good. So, now I am a nurse, like I said, but I'm also a health services and implementation science researcher. I know, that sounds boring, and that's really long. In fact, I can see some of you yawning already. Please don't go to sleep on me. But don't worry, because I'm going to do a different talk to what I usually do. Usually I do one with theories and frameworks and methodologies and all that boring stuff. But tonight, I'm going to be doing it Disney style. Please don't sue me, Disney. Now, let's get to the serious science stuff. Sleep is super important for our health. It regulates our emotions, it gives our brain and body a chance to rest, and it also helps consolidate our memories. Now, experts recommend that as adults we sleep between 7 and 9 hours a night. Now, I can tell you, let me introduce you to the next Disney character. Let me tell you that she did not follow these recommendations. She slept for 100 years. Now, these days we'd call that hypersomnia. So hyper as in too much and somnia as in sleep. Now, treatments for hypersomnia vary, but I can assure you that a kiss from a handsome stranger, or otherwise known as assault, is not one of them. Now, I'm assuming that nobody in this audience has hypersomnia, because that's actually a rare sleep condition, unlike the two most common sleep conditions, obstructive sleep apnea and insomnia. So let's start with obstructive sleep apnea. So obstructive sleep apnea is a condition when the airway closes during sleep and it stops us breathing. So in an attempt to breathe, people wake up momentarily without even realising it, sometimes up to 50 to 100 times an hour. So you can imagine how you'd feel after a night like that. You'd feel pretty tired and depressed. Now, I'm not going to shout out and ask anybody if they've got sleep apnea, because most people don't like to admit that they're old, they're fat, and they snore. But is there anybody in the audience that would like to dob in their partner? Because this is how we often find out that people have got sleep apnea. Their partner comes in with borderline tennis elbow from elbowing their partner all night to stop them snoring and to start them breathing after it feels like they haven't breathed for forever. Now, I must say there is not much more disconcerting than sleeping next to somebody when you think they're dying all night. So, I've got a little bit of nursing advice for you. For those of you out there that just got dogged in by their partner, my suggestion is if you take action for your sleep apnea, you might get more action, if you know what I mean, and not just with an elbow. So let me introduce you to our next Disney character, Dear Winnie the Pooh. Look, we all love Winnie and his obsession with honey, but Winnie is also obese, he snores, and he's over the age of 50, which are all risk factors for obstructive sleep apnea. So does anybody know that Winnie is actually 98 years old this year? He looks pretty good for 98. He really makes me think I should be eating more honey. So, now, let's move on to insomnia. Chronic insomnia. Insomnia is a condition that's characterised by having difficulty getting to sleep, staying asleep, or waking up too early, with daytime symptoms. So people with insomnia feel pretty fatigued. They also feel quite irritable. They're more likely to make mistakes and have accidents. Now, research suggests that about 15% of Australian adults have symptoms suggestive of having chronic insomnia. So if you think about that for the population of Australia, that's actually about 3 million people. That's a lot of people. So, chronic insomnia is... So let me introduce the next character, Sleepy the Dwarf. So poor Sleepy, he was so tired, he bumbled through life. He was always making mistakes, like this example of him trying to swat a fly with a cymbal. That really wasn't smart. He certainly wasn't a scientist, was he? So just thinking about that, do you know a Sleepy? In fact, you might be a Sleepy yourself. If you are, don't worry, I've got good news for you. There is treatment available. So treatments for insomnia can be divided into drug and non-drug treatments. Now, when I say drugs, I don't mean any of that funny business. This is a serious science talk, remember? Although we are at the fringe, so I thought I'd better clarify. So what I mean by drugs is sleeping tablets. So let's enter the enemy in our story. The evil army of sleeping tablets. Sleeping tablets are everywhere. They're prescribed by many of the 32,000 GPs in Australia. They're easy to get with a script, they're cheap, but unfortunately they have side effects and people can get addicted to them. So for example, you can actually get, sleeping tablets can make you feel unsteady on your feet or contribute to you falling over. But hey, that's a good excuse on a big Saturday night if you need one. And is anyone here old enough to remember the days of still knocks as well, where people were reported to be sleep eating and sleep driving on still knocks? Luckily, there were no reports of sleep flying, because that would have been pretty messy. So now just thinking, we've got this big problem, we've got all these sleeping tablets, what are we doing to try to fight off this army? Well, enter Robin Hood, also known as a sleep psychologist. So sleep psychologists are cunning psychologists that are trained specifically to treat insomnia. And their ammunition of choice is something called cognitive behavioural therapy for insomnia, also known as CBTI. So this is a treatment that not many people know exists. So what is it then? It's a 6 to 8 week treatment program. It's basically like boot camp for insomnia. It teaches you to think differently about sleep and how and when you sleep. It's actually very effective, so in about 75% of people that complete the program actually have good outcomes. And it's also recommended by all the world's leading insomnia experts. And it's also recommended by the Royal Australian College of GPs, which is the professional organisation that represents those 32,000 doctors with money and attitude that prescribe sleeping tablets. So I guess the problem is, if we've got this fantastic treatment, why is it we're not using it? Well, it comes down to maths. So we only have 60 Robin Hoods, also known as sleep psychologists, to treat the estimated 3 million people with insomnia. Now, you think about that. 60 people to treat 3 million. That's an equation that would keep you awake at night. So it looks something like this. These poor Robin Hoods trying to fight off this evil army of sleeping tablets, but it's just impossible with there's so few of them. But every Robin Hood needs a trusty sidekick to save the day. And in this case, we have Little John. Although, actually, I'd like to say instead, it's Little Florence, named after the dear foremother of nursing, Florence Nightingale. So that's because Little Florence is a practice nurse. So practice nurses are nurses that work in general practice alongside GPs. Now, there are approximately 96,000 practice nurses in Australia. So research has shown that practice nurses can deliver a brief version of this CBTI. However, they currently don't have the means or funding to deliver this kind of treatment. So just think about that. We've got these 96,000 people out there that could be helping. It could look a little like this. So now, just circling back to all you sleepies out there, just thinking now, perhaps when you're looking for treatment for insomnia, instead of going to doc for help, instead perhaps you could go to see Robin Hood the sleep psychologist, or perhaps, hopefully sometime in the future, Florence the nurse. Little Florence the nurse. But do you know what? I think the real moral of the story tonight is, if you want to stay looking young, perhaps think about doing less staring at the sun, and instead think about eating more honey, because I know who I'd rather be. Thank you.